say that preparing for this talk has been the most fun experience ever.
Yeah.
Although I think we might all be kind of losing energy, so I'll just get on with it. So tonight, ladies and gentlemen, I would first like to acknowledge that this program is brought to you by Merck and Company Incorporated, Merck, be well, and viewers like you. Because tonight we'll be talking about the current meeting of Canadian scientists. So we'll start, of course, with birth, our infancy, early childhood, early adulthood. We'll discuss some of the adventures of these Canadian scientists in the Arctic environment, migration patterns, socialization, and of course recent sightings of said Canadian scientists. So I should give you a disclaimer that if you do try to go do a Google image search of Kevin, it might actually be a little bit confusing. And this was brought to you by my now dear friend and co-conspirator Russell Waterstar Smith, that apparently this is what you find if you look for Kevin. I'm sure it's just a random coincidence. They don't really have much in common. But I would like, for those of you that are geographically challenged, just kind of orient you to Canada. It is, believe it or not, very hard to find a map of Canada that doesn't have the United States attached to it. I don't know. Maybe if you look on Google Canada, that won't be such a problem. But Kevin actually grew up in Nova Scotia. Anyone able to quickly locate it on the map? Just raise your hand if you know where it is. Hey, not bad. Very good. It's to the right. It's dark pinkish. I don't know. Actually see the laser. Anyway, there it's all the way on the right-hand side. And so he was born and raised in wonderful Nova Scotia. And, and as you can see, he was part of a relatively large family. So Kevin actually sent me these pictures. I didn't have to go to his mother or his wife to get them. And I was really struck when I was looking at them because you can see there's two girls and two boys, and I wasn't sure which of the two boys was Kevin. And it turns out, when I was looking at this, I thought, well, you know, the older of the boys in all three of these photos really has quite an impish grin on his face. So I wondered, that might be Kevin, but I don't know if it really looks like him. It turns out that is Kevin's older brother. And Kevin is actually the younger of the two boys. He's the baby in the photo on the upper left-hand side there. And it turns out that his brother actually was quite the rebel and was in and out of trouble growing up, and so Kevin was the good one. And he was the golden child. So apparently his brother, I think, did him a huge favor, and it's still doing so. His brother, by the way, a little fun fact about the Bateman family, is a Royal Canadian Mountie, and has apparently really changed his ways from growing up. So Kevin, as you can see, and we'll discuss this a little bit more in detail later, growing up also had some challenges on the dental front. But they have since been corrected through the wonders of modern dentistry. So
Prescription history.
yeah, you can take your wife. Yes. So Kevin actually did most of his education in Nova Scotia, in Halifax, which is actually, if you look at the map here of the island, it is on the coastal side, and I'm sure the weather there was quite snowy. And he, at this time, actually did have some challenges in high school. So we do see one of his report cards, and it turns out that we probably should consider ourselves fortunate that he became a scientist, because in this particular report card, one of his lowest scores was French, which we'll come back to that later, but was also physical sciences. So surprisingly, his highest score was in history. So apparently a hidden talent there. Perhaps he can further explore down the road the history of science. But at any rate, so Kevin went on to actually study at Dalhousie University, where he obtained his bachelor's. He actually went back and got 2 bachelors, one in education, did a brief stint in teaching and decided he wanted to get back into research, and ultimately obtained his PhD at the same university there. And along the way, he met his beautiful wife, and as you can see here, they have 2 daughters. It's a wonderful family. And they have actually had quite a fun time on various adventures. They just last year went to Machu Picchu, and it turns out, as you can see here, when the girls are a little bit younger, that here with Jose Castro Perez, that I don't know if it was a tea ceremony or you were preparing to sumo wrestle, but the whole family is kind of having some hijinks going on here. Kevin also has been rather courageous with the girls and took them in their full Montreal Canadiens garb to a Philly Flyer game. And he apparently is a good protector because they did not get beaten up. So, what can you say? So Kevin actually, after he graduated, did a postdoc and was hired by Jim Yerke, and ultimately became a full-time staff scientist at Merck Frost. And this, I just wanted to take a few minutes and highlight, was a wonderfully productive and very exciting research-driven organization that Kevin, I know, is very proud that he was part of. And just to give you a little bit of a flavor, I do not quiz me on all of these drugs, but in the time period that Kevin was at Merck Frost, was back to back to back some of the most productive drug discovery and development years of the Merck Frost existence. And you can see laid out, while he was there, there was the approval and launch of Singular, of Vioxx, and Arcoxia. And I know another accomplishment that he's particularly proud of is that he was on actually a championship-winning Merck hockey team. So there you can see him in the middle of the team. However, I think that there may have been some sort of collateral damage from that experience, because as we all know all too well, one of the side effects of hockey is damage to one's teeth, particularly the front teeth. And Kevin was no exception. And actually it's worse than this, but I couldn't get access to that particular photograph. Another thing that Kevin has enjoyed very much during his time in Canada was little known to me, a wonderful television show called The Trailer Park Boys. So, you might want to go and check this out on Netflix. And one of the, I would say, the supplementary characters that turns out to be Kevin's favorite was a character called J-Rock. J-Rock. J to the ROC. Yes, J to the ROC. So to his hockey buddies, Kevin is actually known as K to the ROC. I don't know, K-Rock or Croc, whatever. There are some, I can get you the links and everything if you're interested later, but J to the ROC is quite I'd say a goofball, to put it politely, but is known for his tagline, you know what I'm saying? And you need to be very, very mumbly. So if you want to, greet Kevin in the future, just go, you know what I'm saying, know what I'm saying? So that's the appropriate way from now on, okay? So in his time at Merck Frost, Kevin and a gentleman called Larry Trimble became fast friends. And they really got into all kinds of exciting adventures there in the lab. And you've seen this picture. I think that Gary gave you a preview of it if you were here on the Monday sponsor night. What I'd like to call to your attention is, so there's Kevin on the right-hand side, and Larry is clearly laughing very, very loudly. The reason he's laughing like that is because Kevin has an almond up his nose. You see how easy this was? Kevin also had fun with latex gloves. And here we see, this is, at one point, Laird had to do some training, and he's an NMR expert, so Kevin was trying to help mentor him, and this is Laird learning how to run the mass spec. So, beer in hand apparently is a key step in the SOP for operating it there. So, as you can imagine, there were many, many years of fun and all kinds of escapades going on in the lab. Larry told me that they at one point had a contest where they were shooting Smarties into each other's mouths across the hall, and a lot of running around doing all kinds of goofy things. And I think there might have been some alcohol consumed in that time period, but I'm sure it wasn't during normal work hours. Yes, we have no solid evidence of that. But as all good times and all good things eventually have to come to an end. And these two young heroes, these champions, unfortunately, had to eventually go up against, there was a disturbance in the force. Down in the southern realm, in the land of drug metabolism and pharmacokinetics, there was a movement afoot to take over all other small drug metabolism departments. And these two young warriors did their best. They girded themselves with tinfoil armor, and they attempted to avoid being reorganized, assimilated into the dark side of drug metabolism. But alas, they were unable to do that. And they even went so far as to actually recruit other members to join their army, but still, they were not able to prevail. And surprisingly, once they had lost the battle, Kevin sprung very quickly to the opposite side. He joined the evil emperor, Dr. Tom Bailey, and became not just a believer in the global DMPK organization, but a bioanalytical network leader. And so you see him here. Kevin actually had a huge opportunity to dominate both the qualitative and the quantitative sides of bioanalysis across the global organization. And of course, one of the things I'll talk about a little bit more later that he was really a pioneer in was the use of high-resolution mass spectrometry. And it turns out that at one point in the early days of globalization, Tom and Kevin were in I believe this is a bar in Italy, which you may not be able to read, is actually called high-res. So, very appropriate location for their meeting. So this was actually where I come into the story. I joined Merck around the time that this was all happening and became part of the bioanalytical network. And this is a shot from our first face-to-face, which was held in Montreal. And Kevin had the interesting idea of having us all, even though there was a lot of tension between people who weren't really sure what this was about, we definitely didn't know each other. So Kevin thought that it would be a really good idea for us all to get together and to use sharp knives to cook food that we would then all eat. And surprisingly, no one got food poisoning. So I do want to point out here, it doesn't look very visible to me, but if you're up close, you might be able to tell. This is Rick King here, our super genius, or super soap, on the left-hand side. And if you've seen the picture before or you're close enough, look how happy Rick is. Having such a great time. And honestly, this is how Rick looks most of the time, right? But eventually, not just having to become part of global DMPK, but actually having to join the mothership in the United States was required. And so Kevin moves to West Point, where he had to take on an even bigger challenge, which was to come to a brand new flavor of the dark side, which was regulated bioanalysis. In that time period, he actually learned, I think, far more than he ever wanted to about method validation and the analysis of clinical and GLP samples. And in that time period, he's been able to, I think, have a little bit of fun, but actually have a really huge impact in a lot of different areas, including this year. This is actually a bona fide selfie that Kevin took with a couple other Merck colleagues, Brad, I'm sure you know Prajati. And this was basically an initiative where the three of them went and had an open discussion with the European Medical Authority about the use of dried blood spots in different clinical trials. And I think this really has a very beneficial effect, ultimately, not just for Merck, but for the entire industry. And we talked a little bit about that last night at the microsampling stuff. So we're going to take a little bit of a break here. I'm going to take a page from Brad's book and have some audience participation. So Kevin never takes himself too seriously. So I've got a little quiz for you. We have to. This year there was an initiative where we all had to put together in a global system our career profile and sort of a different flavor of your CV. So audience participation, little quiz, which of the following was not something that Kevin listed as a skill or a certification? Mass spectrometry. I gotta make it easy, right? It's getting late. Abacus counting. Artificial insemination technician. Commercial truck driver's license. Or BNC. Just call out your answer if you know it.
Hey.
Hey. Well, believe it or not, it is D. Although I think, Jane is here, our business manager, and maybe it should be part of your career development plan that you get that commercial truck driver's license, because when you go back to Canada, you never know, you might do some ice road trucker kind of thing, or, it might come in handy. All right.
Yeah.
So now that Kevin has migrated here to the United States, one of the traditions, which apparently was, again, held last weekend, but we weren't invited, right? And we're not bitter. There's something called Meat Fest, in which this is going back to, I guess, CPSA Brazil sort of flavor, that some prime cuts of different kinds of meat are grilled. Huge quantities of alcohol are consumed, and there's a lot of male bonding that goes on. And so you can see, wait, I did the wrong thing. Some of these aren't really displaying too much, but here's Kevin playing Mario Kart. This is a typical kind of activity during Meat Fest, as well as some hot tub activities going on. So, I know Kevin hates this. He's looking remarkably relaxed, considering how uncomfortable he's been up until this very moment. But in all seriousness, he's had a tremendous impact in a broad variety of different areas, not just within drug metabolism, but across discovery and development. And so I just want to give you the highlights. It would take a long time to read through everything, that's for sure. He's got over 50 publications, he's got patents, he's got all kinds of presentations in his CV. And I talked to him about really what he felt the most proud of, and it's the first bullet here. Because working at Merck Frost, he worked with the folks in the vivarium to come up with a way that instead of having to sacrifice animals at each of the time intervals that you wanted to measure, that you could do a tail vein sniff, you could milk the exact quantity of blood, add citrate buffer, and then really reduce the number of animals that were used in these mice studies. And that was implemented across the entire Merck organization. So in terms of impact, not just from a humanitarian perspective, but from a business perspective, and of course just being more resource efficient, it was really a huge impact. And of course, we talked yesterday, he was the pioneer, the first person in pharma to ever try to use dry blood spots, being inspired by the folks like Don Chase. And of course, that's just on the quantitative side, but really tremendous amount of effort going on to use high-res mass spectrometry to identify metabolites and to really drive the science of drug metabolism. As well as, of course, Kevin really likes to push the envelope to combine quantitative and qualitative analysis and really make the most of the data that we spend so much time and energy acquiring. So just to lay that out a little bit more, he's done a lot in terms of making sure that we have standard platforms across the company in this area, as well as liquid handling. And really, I don't have time to share with you a lot of the testimonies that people talk to me about in terms of how much they appreciated Kevin's mentoring, his training, his guidance, him really being a wonderful role model for all the scientists in the organization. So again, I can't really go into a lot of the detail, unfortunately, but Kevin also has served as a program team lead representing the drug metabolism department and elucidated various biotransformation pathways for Merck molecules. And that, of course, is a typical in vitro, in vivo assay type coordination, interpretation, and of course writing it all up and submitting those documents to various regulatory agencies. And just to give you a flavor of that, unfortunately, drug discovery, a lot of attrition, a lot of projects we worked on didn't progress, but some of the successful ones included Cordaptive, Vanicative, which I think is going to file one of these days, and of course Biomes. So this came out that earlier, I believe, but remember back in the late 80s, early 90s, we had Bo Jackson. Bo knows hockey, Bo knows baseball, et cetera, et cetera. Well, I think, there's some similarities. And so if I think about what Kevin knows, well, Kevin knows drug discovery and development. He understands medicinal chemistry, capillary electrophoresis. This is going back to his graduate school training. Atomic emission spectroscopy. He knows basically any kind of analyte you can name. He knows how to figure out how to identify it and quantitate it. A couple other random ones. He knows laser dissociation, thermal dissociation, design of experiments. Now he knows regulated bioanalysis since he's lived in the dark side. And, that's really only a flavor of everything that he has in his skill sets. So to keep it a little bit light, I will give you some instructions. Remember, we're talking about the care and feeding of these Canadian scientists. So it is a precautionary measure. It is prudent to not allow him to be close to any sharp objects, namely those X-Acto knives, because he did have a habit of, on multiple occasions, cutting himself, having to run down to the nurse and get bandaged up. And according to Mark Verona, in one situation, he did it. He cut himself, and then he kept going and cut himself again. So, I don't know about that fast learner thing. Yes. Yes. Yeah, so you do want to, in the event that you are not able to keep them away from him, to be prepared to administer first aid. And he does really like it if he, if he does something that you appreciate. He really likes pickles. So just head over to Costco or BJ's and give him a huge jar of pickles. He likes that. And the other precautionary measure, some of you it's too late, but he has this app on his iPhone. So if he takes a picture of you, he's going to caption it with something really kind of naughty. And there are some senior members of Merck management that he's got, well, not naked pictures, but definitely some interesting pictures with funny captions.
Job secure.
So,
This, we'll come back to the photo, but just in case you are, attempting to identify the Bateman out in the wild, the KF to the ROC, one of the things that you will be able to differentiate him from others is the fact of his highly collaborative nature. Harry Truman once said, "It's amazing what people can get done when they don't care who gets the credit," and Kevin really embodies this. That he just wants to see the right thing done, and is not arrogant. Really, a very humble person. He's amazingly creative. A lot of these jokes he actually gave to me. You see the things that he was doing in the lab. I find him to be incredibly witty. I'll tell you at the bar if you want to hear a little bit more of the witticisms. And of course, he's got tremendous energy. I personally don't think I could ever keep up with him in terms of how many new ideas that he's always thinking and working on, and networking. It's just incredible. He definitely is never hesitant to tell you how he feels, so that's really something that I admire. And he's a really strong work ethic. Again, is a great role model for everybody. And ultimately, he just wants to get the right thing done. He's not a theoreticist or someone that doesn't understand that we have to be practical. And the other thing, if you do ever run into issues, you can easily distract him. Someone called him a scientific butterfly. Pollinating, right? But I would like to point out, remember how Rick looked in that picture, or how he looked when Nate was giving him that t-shirt? He actually had a smile on his face. I don't know if I've ever seen Rick smile like this, and I know that it was because Kevin was doing something goofy with that face. So, at any rate, one caveat I will give you is if you're going out trying to identify the Bateman out in the wild, that not just doing Google Google searches, but also sometimes it may be a bit hard to find him and distinguish him from other people, because what you will see is that sometimes people take on his persona, and in fact, the reality is we all would like to be Kevin Bateman, wouldn't we? So why don't we?
Kevin!
So, Mike, we're going to take a picture. Where's mine? Oh, yes. Yes, we have another presentation.
Should I get costume?
Yes.
I can't see you.
So, for the one and the only, the Dr. Kevin P. Bateman.